my name is Christy Bricker, and today we're going to be doing the final assessment, physical assessment, and it's going to be our complete head-to-toe assessment. And this video is done for Rowan University. And this is my patient. Please state your name, and if you could give permission to be in this video.
My name is Summer Perry, and I give consent to be in this video.
Thank you. So we're going to start, the first system we're going to go over is going to be your eyes. So first I want to ask you, do you wear glasses?
No.
And when was your last eye exam?
I believe in April.
Okay. Any vision problems?
No.
Okay. And it's important, though, to protect your eyes. Make sure when you are out in bright sunlight that you do wear sunglasses and get those annual eye exams. So first we're going to check her vision acuity. We're going to start with far vision test.
Okay.
So we would use the Snellen eye chart. So for this size chart, I would stand about 9 feet away from her, and I would ask you to read the smallest line possible. Cover one eye, please.
FELGFZE.
Good. So that's 20/25 on that eye. Switch hands, please, and do the other eye. Read the smallest line.
DBFROTDO.
Perfect. That's 20/20 in that eye, so that's good. And then just to check her near acuity, I would give her like a newspaper and just ask her to read a couple lines of that first paragraph.
Out loud.
Yes, please.
Trenton legislation intended to give thousands of New Jersey small business owners a way to avoid paying higher taxes because of federal government.
Perfect. Thank you. So her near acuity is fine. I'm just going to set these out of the way. All right, now we're going to check your confrontation, which is your peripheral vision. So I want you to cover one eye with your hands. And I'm going to also cover the same eye, and I'm going to move my fingers in from this side. And when you see them enter your visual field, I want you to say now.
Now.
Good.
Switch.
Yes, please.
Now.
Okay, good. And now we're going to check for direct and consensual reactions to your pupillary reactions. So what I'm going to do is I'm going to shine the pen light into your eye. Just look straight ahead for me. And I'm going to watch to see if her pupil shrinks with light, and it does. And now for consensual, I want to check while I shine the light in this eye, make sure that the pupil in this eye is contracting as well, which it does on both sides. Okay, good. We're going to check your extraocular motor function. So I want you to follow the pen with your eyes, okay? We're going to go through the 6 cardinal positions. Okay, and her eye muscles are intact. Now I'm going to do the corneal light reflex, which I'm just going to shine the light. You can look straight ahead directly on her eyes, and I can see that the light reflects on both of her cornea at the same spot. So that's equal on both sides. All right, next we're going to move on to your ears. Do you have a history of any earaches?
No.
And how about hearing loss or difficulty with hearing?
No.
How about chronic ear infections?
No.
All right. One thing a lot of people do though now is they wear headphones or the AirPods to listen to their music. Just make sure when you do that, keep the noise level down, because that long-term effect can have a damaging effect to your ears and your hearing. So we're just going to look at her outer ear, and I'm going to inspect the tragus. Look at it here. All right. I'm going to use a light to check her external ear canal. Just checking for any cerumen or wax buildup, which I don't see any. Now I'm going to, if I had a tuning fork, I would be checking for bone and air conduction. So the Weber test would be the first one I would do, and if this were a tuning fork, I would smack it and I would stand it on top of her head, and she would tell me if she feels the vibrations equally on both sides and both ears. And then the Rin test, I would do the same thing, smack it, and I would hold it behind her ear. She would tell me when she stopped hearing it, and then I would hold it next to her, and then she would tell me when she stopped hearing that as well. We'll do the whisper test. Check your hearing now. I'm going to whisper on one side, and you tell me what word I'm saying.
Final. Exam.
Yes. All right, next we're going to move on to nose and mouth. So do you have any sinus infections? Do you normally get any sinus infections?
No.
How about a history of nosebleeds?
No.
And any difficulty swallowing?
No.
Okay. Oral hygiene is important, so you should visit your dentist at least twice a year. All right. So I'm going to first inspect your nasal mucosa. So I want you to tilt your head back a little bit. I'm going to look and make sure that her nares are patent. And then I want you to verify that, I want you to hold your finger over one nair at a time and inhale. And then the other side and inhale. Okay, I'm going to put these gloves on, but I want to palpate your sinuses as well, okay? So I'm going to check to see if there's any swelling in her frontal sinuses here. I don't feel any, and her maxillary here. And then we're going to do transillumination, which will be, I'm going to shine a light here, and I'm going to cover, and I'm going to look for that red glow above here to check her frontal sinuses. And if you stick your head way, way back, open your mouth and say, ah. And I would shine the light in here and see if I see any light shine through to make sure her sinuses are open and patent as well. In here, I'm going to check your teeth if you open wide again for me. So make sure there's no dental caries. Everything is in line. Buccal mucosa looks good. It's pink and moist. And I'm going to check for her Stenson duct, which is from the parotid gland up here. It's like a little dimple and I can see it. There. Okay, good. I want you to stick out your tongue. I'm going to depress the back of her tongue while you say ah, and I'm going to check to see if your soft palate and your uvula rise. Say it one time. Very good. And I can see her tonsils in there. They're not swollen. They're just a 1+, and they're just visible. All right, now we're going to move on to your head and neck. Oh, I forgot. Before we move on to your head and neck, I want you to stick out your tongue, and I want you to move it from side to side. Make sure her tongue movement is intact. All right, so for your head and neck, I'm going to ask you, do you have a history of headaches?
No.
How about, do you have any dizziness or vertigo?
No.
And do you have any neck pain?
No.
All right, one good relaxation technique would be like to get massages to help if you had any neck pain. All right, so I'm going to feel your head first, and I'm going to check for any lumps or any swelling anywhere, which I don't. All right, and then we're going to check her cranial lymph nodes. So first we're going to start with the pre-auricular, right here in front of her ears, and we're going to palpate there. Her post-auricular. On the back of the head, we're going to feel for her occipital. Then underneath her chin, I would feel her submental and submandibular. On her, down her neck, I would feel her superficial cervical, the deep cervical, posterior cervical, and then the supraclavicular. And I don't feel any swelling there. I can see her trachea lies midline. I'm going to go around back, and I'm going to feel for her thyroid. So just relax, extend your neck back a little bit. All right. And then I want you to swallow. And I actually don't feel her thyroid at all, so there's no swelling or anything going on there. I can also check her carotids while I'm here on her neck. So one at a time, I would just palpate for her carotid pulse. And then I would just auscultate to listen for the presence of any bruise. And there are none. Now for range of motion of your neck, I just want you to look back and then down to the chest, side to side, and then ear to shoulder. Good, perfect. So now we're going to move on to her chest and lungs. First, I'll ask you, do you have any history of asthma?
No.
Are you a current smoker?
No.
And do you have any kind of cough, productive or non-productive?
No.
Okay, good. So one of the things to promote healthy lungs is, I know you exercise a lot, and exercising, walking, anything like that, cardiovascular exercise is good to promote healthy lungs too. So we're going to first inspect her thoracic cage and make sure that it is symmetrical. And I'm going to actually ask you to swing around. We'll start with your back, so if you can swing your legs and maybe just sit like crisscross applesauce. Okay. And I'm just going to look here to inspect her thoracic cage. And take a deep breath. I want to make sure the expansion is symmetrical on both sides as she takes a deep breath. Okay, so I'm going to feel now, sorry my hands are cold, but I'm going to feel now for any crepitus. And then I'm going to check for tactile fremitus. So I need you to say, I'm going to go in the intercostal spaces. I want you to repeat 99.
99. 99. 99.
And I can feel those vibrations
99.
as I go down on both sides.
99.
And they should just be equal
99.
and symmetrical on both sides. I can also check for bronchophony, and that will be where I'm listening while she says 99.
99.
And it should sound
99.
muffled, which it does.
99.
And then I can also check for egophony, where you would say E.
E.
And I'm going to hear the E
E.
sound as she does that.
E.
If I hear the A sound, that may mean she has some sort of infiltration. Next, I'll do the whispered patriloquy, where I want you to whisper 1, 2, 3. I cannot hear it; it's completely inaudible, which is how it should be. I'm going to percuss her posterior thorax now. So I'm going to hear dullness over the lung fields as I do this. And I'm just going to go from side to side, side to side. I'm going to listen again for her lung sounds while she's not speaking, and just listen for any adventitious lung sounds, any wheezing or crackling. So just take a deep breath, inhale and exhale. And again. Again. And you're going to move through all the lung fields doing this. And you can turn around to the front. I'm going to again just inspect her anterior thoracic cage and watch with chest expansion as she takes a deep breath. Good. I'm going to palpate for any crepitus. And then I'm going to do the tactile freminus here and just say 99.
99. 99. 99.
Move through the intercostal
99.
spaces here. And
99. 99.
Okay, good. Okay, now we're going to move on to cardiovascular. So in reference to your heart, do you ever experience any kind of chest pain or angina?
No.
Any edema over your lower extremities that you've noticed?
No.
And do you ever get short of breath with exercise or on exertion?
No.
Okay, great. So one of the things we can do also to promote a healthy heart is eating a heart-healthy diet. So stay away from saturated fats and things like that. Make sure your cholesterol is low. So I need you to lie down for this part. I'm going to ask you to swing your legs over here. First, I'm just going to inspect her precordium. And then I'm going to palpate here. So the precordium of her heart. And then I'm going to palpate for an apical pulse. Okay. We're going to listen for her heart sound. So I should hear S1, S2. And I'm going to go over all of the positions of the valves. So we're going to do the pulmonic and the aortic, the tricuspid, and the mitral. And you should be listening for any secondary sounds or any adventitious sounds there, which I don't hear any. While you're in this position, I would be visualizing her jugular vein and look for any distension there. We could also do the carotid pulse and listen for bruits and palpate them while she's in this position, but I did them while she was sitting up. So now that you're lying down, we're going to check your abdomen as well. So first, I just wanted to ask you about your appetite. Have you had any changes of appetite?
No.
And do you have regular bowel movements?
Yes.
Okay. And do you have any abdominal pain now, or is it like a chronic condition of any kind of abdominal pain?
No.
Okay, good. So one of the things that we can do to promote a healthy gut is to eat probiotics, and yogurt is an excellent source for probiotics. So I'm just going to move over here. While she's lying down, I can see that her belly is flat, and I don't see any bulges or hernias or anything here. So we're going to, first before you palpate, you're going to auscultate. So I'm going to listen for bowel sounds in all 4 quadrants. And just because they're short on time, I'm just rushing through the auscultation part of these exams. We would then do light palpation, just so she can get used to the feel of my touch, and then the deeper palpation. So we're going to be checking for like ascites or any symptoms of appendicitis. All right. So to check for appendicitis, we would check like the rebound test, and I would do a deep palpation and then a quick release. Any pain there would indicate appendicitis. So then we would also do the obturator test, which I would have you bring your knee up to your chest. And if that elicits pain, that's a sign of appendicitis. And the ileopsis test, you're going to raise your leg straight, and I'm going to push down your thigh. And as you're pulling up, if that elicits pain, that could be a sign of appendicitis. And now I want to try and locate her liver here. So I'm going to do a deep palpation here. And every time she exhales, I'm going to move up a little closer, and sometimes you can feel the base of the liver as you do a deep palpation. Take a deep breath for me. If that triggers pain, then that would be a sign of liver inflammation. And that would be the positive Murphy sign. So another way to check for ascites, I'm going to ask you to put your hand like this. and we would do the fluid wave test. So while she's doing that, you would tap the abdomen on one side, and if you feel the fluid move across her abdomen to this side, then that would be a positive fluid wave test. And then you can also palpate for that. Percuss for that. So I'm going to percuss over her abdominal area, and it should be tympanic everywhere I percuss. In all of the all four quadrants. To do to check for ascites, you're going to see if there's any kind of shifting dullness. So it would be if she had ascites, the fluid as she laid down would move over here. So it would be tympanic here and then dullness here. So you would percuss and see if you hear any dullness, which she does not. Okay, and then I'm going to ask you to sit up. And actually swing your legs back over that way, do crisscross applesauce. I'm just going to check and see if she has any pain in her kidneys. So I'm going to place my hand over the costovertebral angle, and I'm just going to do a percuss here with actually like a fist. And that should not elicit any pain in her kidneys. Any pain?
No.
Okay, good. Okay, you can swing back around now. And if you want to put your shirt on, you can put your shirt on, because we're going to move to musculoskeletal at this point. So while you're getting dressed, I'm going to ask you, we'll start with your upper extremities. Do you have any stiffness or pain in your shoulders or joints of your upper extremities?
No.
And no swelling in your hands or arms?
No.
All right. Have you had any surgeries to your shoulders or rotator cuff, anything like that?
No.
Okay. And since you do go to the gym and work out, just make sure you do a lot of stretching exercises so you don't damage any muscles or joints. Okay. All right, so I'm looking at her shoulders, and I'm just going to look and then palpate her upper extremity joints. Just see if there's any lumps or swelling, and I don't see any. And then I want you to do active range of motion on these. So I need you to rotate your shoulders. And I want you to do extension and flexion of your elbows and your wrists. And then you can do your fingers as well. Okay, good. Now I want you to do that against resistance. So raise your shoulder up against resistance and lower it. Okay, and then your arm, you would extend it and then flex it. And same thing with your wrist, against resistance, there you go. Okay, and then try and open your fingers. Okay, good. And we would do that for both arms. I'm going to check her, while I'm here on her arms, I'm going to check her epitrochlear node, which is going to be like in this portion of the arm. And you would check to see if there was any swelling or lymphatic drainage here, which there is not on either side. We're also going to palpate her pulses on her upper extremities. So we would check her radial pulse at the wrist, and then the brachial pulse up here at the elbow. We can check for carpal tunnel. So to do that, I would use use just percussion. I'm going to just percuss right here on the nerve here right on her wrist. And hold your, there you go. And if that elicits pain, that would be a sign of carpal tunnel. And that's the Tinel test. The Fallon test is where you would put your back of your hands together and push. And any pain doing that?
No.
Okay. We're going to check for scoliosis now real quick.
Stand up.
Yep. I want you to turn around and face the back wall. Move a little bit to your right. Good. So we can check for scoliosis by checking her shoulder height and make sure that they're equal. Another way, pull her shirt tight, you can check the gap between her, no, you can hang your arms down. Just in a relaxed state, the gap between her arms and her waist there. And then if you bend over in half at the waist, dangle your arms, you're going to check for any kind of curvature of her spine, which I don't see any without a scale. But okay, you can turn around and sit back down again. Now we're going to work on your lower extremities and any pain or issues with your musculoskeletal system there. So I know in the one video we did, you were suffering from some knee pain. Is that true? You have chronic knee pain?
Yeah, it goes in and out.
Okay. How about the hips? Any pain in your hips?
No.
And how about your lower back? Because that's a big thing with, especially as we get older, we all suffer from lower back pain.
No.
All right, good for you. So one of the ways to avoid damaging injury to your lower back is to maintain good body mechanics, especially when lifting. And you should always push instead of pull when possible. So I want to look at her joints of her lower extremities. So this time I'm going to ask you to lie down and put your head up this way so I can just check. So we're just going to inspect her hips and her knees and her ankles. And just visually looking at them, they all seem to be fine. So I don't feel any lumps or anything or any swelling anywhere. So I want you to do some active range of motion. So I want you to flex at the hip and then flex and extend at the knee and again at the ankle for me. And then bend the knee and the ankle. Okay. I want you to do that against resistance too. So you would push and then there. And now try and bend your knee. Good. And now extend. Okay, we're going to do the same thing with the ankle. I want you to push towards my hand and push towards my hand. Okay, good. And we will be doing that again for both legs. We're also going to check her lower extremity pulses now. So we would check here for the femoral. And then down here, can you see it? Okay. Yeah, we would do the posterior tibial and the dorsalis pedis. Sometimes you can elicit a popliteal pulse here on the back of the knee, but it's a little bit harder to find. We're going to do 2 tests on her knees, especially since she's been having knee pain. One is the bulge test and one is the ballottement test. For the bulge test, I'm going to pull your leg up a little bit. So we would, if there was any fluid, we would try and push it up this way. And then we would tap on the outer aspect of her knee and see if the fluid moves, if we can feel fluid movement on the interior side of her knee. For the ballottement test, we would hold the fluid on the top of her knee down, and then we would use our fingers to push underneath the patella and have it go flush up against that femoral bone. And if there was fluid there, it would not sit flush. Okay, sorry about that. Now, while you're in that position, we're going to check and see if she has any sciatic nerve pain. So I want you to do a straight leg lift, please. Okay, good. And I think that's it for our lower extremities. So you can swing your legs around, sit back up. I'm going over our 20-minute time limit, but I'll try and speed it up. Cranial nerves are what's next.
Okay.
So, do you have any history of head injuries?
No.
How about seizures?
No.
Okay, great. And any difficulty swallowing?
No.
All right. And one of the big things I know I worry about, like with my son, is concussions. So you always have to worry about protecting your head. If you ever ride a bike, make sure you wear a helmet, things like that, okay?
Okay.
So our first cranial nerve that we're going to do is cranial nerve number 2, and that's the optic nerve. And we're going to check for visual acuity, which we did when we did her eyes. So we did the Snellen test, we did a confrontation test, and I actually borrowed one of these from work, and I could use the ophthalmoscope to check her optic disc to check for the optic nerve and cranial nerve number 2. Cranial nerve number 3, 4, and 6 are going to be your oculomotor, trochlear, and the abducens nerves. And they're going to be your extraocular movements, and along with the light reflexes and the perla, which we did when we did the eye exam. So moving on to cranial nerve number 5 is your trigeminal nerve. So to check to see if that's intact, I want you to clench your teeth. And then I want you to move your jaw from side to side. Okay, good. Part of that also is sensation. So I'm going to have you close your eyes. I'm going to use this Q-tip, and we're going to test to see if she can feel if it is the soft side or the sharp side that's touching her cheek. Okay, tell me if it's soft or sharp.
Soft. Sharp. Soft. Sharp.
Okay, good. For cranial nerve number 7, it's your facial nerve. I need you to smile and frown and puff out your cheeks. And that tells me that all the first 7 cranial nerves are intact. Moving on, we're going to do cranial nerves number 8 through 12. So for this, I would just want to ask you, I think I asked you in doing your ears, or any hearing loss or difficulty hearing?
No.
Do you have any ringing in your ears or tinnitus?
No.
And did I ask you about swallowing? I did ask you about swallowing already. Any pain or stiffness in your neck? I think I might have asked you about that one too.
No.
All right, how about with speech?
No.
Any dysphagia, anything like that?
No.
Okay, good. So we're going to check, and one of the things that helps with your neurological system is your diet, believe it or not. So eating a diet rich in vitamins B6 and B12 and staying hydrated will help your neurological system. We're going to check your cranial nerve number 8, which is your acoustic nerve. Normal conversation tells me that her acoustic nerve is intact because she's answering me appropriately. We also did the tuning fork test, the Tin and Weber test, and well, we pretended to do them, and we did the whisper test. So I know her acoustic nerve is intact. For cranial nerves 9 and 10, it's the glossopharyngeal and the vagus nerves. So for that, I'm actually going to put gloves on again. And I'm going to ask you to swallow. So I can see she can swallow, so that's intact. I'm going to check her, I would be checking her soft palate and her uvula again, like we did before. Stick out your tongue. And when she says ah and it rises, that would show that that's intact. If I use this and touch the back of her pharynx there, and it would elicit a gag reflex, or the glossopharyngeal nerve. When you stimulate that, it's going to elicit a gag reflex, which I'm not going to do. Next, we're going to do, I'll take these off, your cranial nerve 11, which is your spinal accessory. And for that, I want you to shrug your shoulders for me. Hang on. Shrug your shoulders against resistance, and then turn your head towards my hand. Good. And then the last of the cranial nerves is your hypoglossal. So I want you to stick out your tongue, and I can see that it's lying midline. And then I want you to say light, tight, dynamite.
Light, tight, dynamite.
And as long as she can say the L, the T, the D, and the N crisp and clearly, then I know that her hypoglossal nerve is intact. Okay, so we're going to go on to her cerebellar function at this point. Do you notice any tremors in your upper extremities?
No.
And any difficulty walking or any balance issues?
No.
And how about coordination? Any trouble there?
No.
So one of the things that can affect their cerebellar function is alcohol intake. So we need to also be careful we don't have too much alcohol, or we're not at risk for alcohol abuse. So we're going to try your rapid alternating movements for this. So for this, I want you to put your hands, you hit your top of your leg, and then turn them over and hit with the back. And do that as fast as you can. Good. Now I want you to, with each of your hands, just touch your nose. Close your eyes and touch your nose. All right, good. And we'll do also the tandem walking, which is heel to toe. If you can stand up and do the heel to toe for me. Just a few steps back and forth. Okay. And then come back. We're going to do the Romberg test. The Romberg test, you can turn and face this way. You're going to close your eyes and just keep them closed. And as she stands and does not sway, then that's negative Romberg. If she were to sway, that would be positive. And then for the pronator drift, I want you to just, with your eyes closed, put your arms out in front of you, palms up. And the same thing, she would stand there for like 30 seconds or more, but we're short on time, so we're not going to do that. And then you can climb back up on the bed. We're going to do the heel to shin test. So for her coordination, I want to see if she can drag her heel up her shin to her knee.
Up.
Yes, please, on both sides. Okay, good. And again, we're going to check for sensory. So I want, with your eyes closed, I want you to tell me if you feel sharp or soft, okay?
Soft. Sharp. Sharp. Soft.
Okay, good. And then we can check vibrations too. If I had a tuning fork, I could strike the tuning fork and then hold it like on a bony prominence, like her big toe, and that she would tell me with her eyes closed if she feels a vibration. So also with your eyes closed, you can give me one of your hands. I want you to keep your eyes closed. I want you to check position. I want you to tell me if I'm moving your finger up or down.
Up.
Okay. Let's try this one.
Down.
Okay, good. And then again, all these are going to be with her eyes closed. We're going to check for graphesthesis. So I want you to tell me what number. I'm not really going to write it, but I want you to tell me what number I'm writing on your hand.
3.
Good. And then the other hand.
6.
Good. To check stereogenesis, I'm going to keep your eyes closed, put 2 small objects in your hand, and you tell me what they are, okay?
Mm-hmm. An eraser.
Good.
A battery.
Perfect. All right, finally we're going to move on to deep tendon reflexes. So any history of a TIA or a stroke?
No.
And have you been in like any kind of motor vehicle accident and have suffered a spinal cord injury?
No.
And do you experience any numbness or tingling in your extremities?
No.
All right. Make sure we always wear a seatbelt at all times when we're in a motor vehicle. And smoking cessation as well. If you smoke, you're increasing your risk for TIA or stroke. So for our deep tendon reflexes, I'm going to leave you sitting up at this point. I don't have a hammer, so I'm just going to use my pen light. So first I'm going to check your brachial radialis. So I would strike right here, and it should make her thumb twitch. Then her bicep tendon, I would strike here. It should also make her thumb twitch, and I would do it on both sides. For her triceps, I'm going to hang it here, and I would strike back here behind her elbow. Her arm should swing out this way. For her patella, if her legs were dangling, I would strike just underneath the patella, and her leg would reflex outward. And then for the Achilles tendon, I would strike back here, and her foot would flex. Right? So for the final one is going to be cutaneous reflexes. I want you to lay down your head that way and your feet this way. Okay, so I think we can see here. And pull up your shirt for me just a little bit. So I'm just going to use something soft, and if I drag it down her abdomen, it's going to elicit that reflex where she kind of tenses up on her abdominal muscles. And then lastly, we're going to do the Babinski reflex, and that's going to be on the bottom of her foot. And if I take a pen and I go from the heel to the toe, that's what it's going to do. It's going to elicit that reflex. Okay, you can sit up, pull your shirt down, and we went over our limit, but we're all done. Thank you.